Hi, and welcome to another episode of Health Naturally. I'm your host, Paul Gerst, and I'm a licensed professional acupuncturist of 16 years and owner of New England Natural Health Services in Plymouth. This show is on rehab services. I began my career in healthcare working in physical therapy approximately 30 years ago, and having had experience in both outpatient care and about a dozen nursing homes, I have experience with speech, occupational, and physical therapy and various techniques used to help patients rehabilitate. Although some things are the same as they were when I started, a great deal of advancements have been made, and I have brought in two guests to share some of the improvements to the field of rehab, and I will introduce them to you shortly. As Health Naturally is about bringing you information on alternatives as well as advancements in healthcare, I would be remiss if I didn't discuss, albeit briefly, how rehab is handled on my current side of the fence. As is often the case, a patient presents to me after going through the Western medical model. For example, in the case of a musculoskeletal injury, that person is often prescribed anti-inflammatory agents followed by physical therapy, and in the case when there is little to no improvement, consultation with an orthopedic surgeon and maybe surgery. When that patient does not have the desired results with the Western model, they often choose to try acupuncture and/or alternative medicine. When the patient presents, a detailed intake with signs, symptoms, and history is collected. Often, tongue, pulse, ear, eye, skin, nails, speech patterns, etc. are all added to the collected information, and a diagnosis is arrived at. A treatment plan is set up directed at both the underlying cause and calming or stopping the symptoms. In the case of a musculoskeletal injury, this may involve doing acupuncture to help energy and fluids move through the injured area to relieve pain, and treatment of internal organs that are involved as part of the root or causal condition. A further example of this and why acupuncture and natural medicine have been so successful in cases where the Western model failed, take a chronic shoulder injury where the original episode didn't involve a severe blow or twist, but the shoulder, quote unquote, popped when that person was doing a normal activity, and it, quote, just never felt the same after that, unquote. The underlying root was found to be in the stomach, which under the Western model never would have been detected. In Chinese medicine, the rules are set up for us to look at the whole body and thus get a holistic diagnosis. Change the underlying cause and the condition may be properly treated. Don't, and you have a patient headed for surgical repair and often more problems. Regardless of the side of the fence one chooses to work with, it is important to get to the bottom of why a problem is there. Symptoms are messages from the body, and there are many qualified health practitioners that can help you. If you feel your practitioner is not getting to the root of your condition, consult with one or more practitioners from different areas so that you may get a broader understanding of your options and what your body may be trying to tell you. Let's meet our guests and learn more about who they are and what they do in the field of rehabilitation. Hi, I'd like to welcome our guests tonight, Chris and Andrea Plant. How you doing?
Hello.
Thanks for being here. Andrea is the Director of Rehab Services at Life Care Center of Plymouth, and Chris is the Field Advisor for Mass EDP. Chris, what's Mass EDP?
It's the Massachusetts Equipment Distribution Program, and it's part of the State 911 Department.
Okay. So I'm going to start with Andrea. Andrea, you're with Life Care Centers of Plymouth. Tell us a little bit about your job there.
Sure. Life Care Center of Plymouth is a skilled nursing facility, so that includes both long-term care as well as short-term rehab. We have about 150 beds there, and we have offer rehab in our department 7 days a week.
So most people have a general understanding of what rehab involves, say physical therapy after joint replacement, for example. Please share some of the newer, different interventions provided that people may not be familiar with.
Sure, I'd be happy to. There's actually a lot in the rehab world that therapists are involved in that, like you said, people might just not even be aware of. I brought a couple things I can show you.
I like toys.
First of all, my speech and language pathologists often work with people who have swallowing dysfunction. It's called dysphagia, so people who have trouble swallowing. Oftentimes you think of someone maybe after a stroke who has trouble swallowing, or someone who has a progressive disorder. And both my speech therapists are certified in a therapy called Vital Stim. So this is the Vital Stim unit. It's a type of electrical stimulation that's used to strengthen the swallowing muscles for people who have a swallowing disorder. So essentially, you put these pads on the neck, and it's used, you can either have the Vital Stim unit on while doing strengthening exercises of the swallowing muscles, or while someone's eating a meal. And the idea is to strengthen those muscles, and it provides kind of an accelerated recovery from a restricted diet, so that people with swallowing troubles can return quicker to being able to eat and drink what they want.
Am I right in thinking that that's like a neuromuscular stimulator?
Exactly. It's very similar to E-Stim that people might be familiar with to strengthen, your leg muscles or things like that, but it's used for the swallowing muscles specifically.
Could it be used to make somebody be quiet? just curious.
We could explore that option.
All right. So then you have something for wound care, is that correct?
Yeah, so wound care is another area, again, that people may not even realize therapy is involved in, but we offer lots of different ways that people, therapies that can be used to help with wound care. Most recently, we've started using a system called closed pulsed irrigation, or CPI. This is the unit, so you can see that it essentially looks like a water gun, really.
Yeah.
And it would be hooked up to a system that sprays a normal saline or a certain type of a solution into a wound. People can have wounds in a skilled nursing facility for a variety of reasons, whether it's diabetic ulcers or pressure ulcers. And so therapy can be involved with a system like this. The spray helps to clean the wound area, get rid of any dead tissue, and hydrate the area, and just overall accelerate recovery and healing of wounds. So this is something that nursing and therapy can collaborate on to hopefully help with wound care.
Now, is this a proprietary device? In other words, your company is...
We are affiliated. Dr. Marasco is the physician who developed CPI, and he has been going around to life care centers all over America, helping train us on this type of modality.
So when was that brought on? When was that developed?
Life Care Center of Plymouth just started introducing CPI back in the fall, although it's been around for longer than that. But we've just started rolling it out and have had some good success with it. So it's been nice to add another thing that we can provide to help people heal their wounds.
Looks like a fun toy. Thanks for sharing.
Sure.
What's the next thing? This is what I'm excited about.
Yes, people may or may not be familiar with the Wii.
The Wii.
The Wii. So it's a video game system that over the past, say, 5+ years or so, people have been exploring how you can incorporate the Wii into rehabilitation.
Say the word. Say the word.
In fact, rehabilitation is now an accepted terminology that's used in research and applying it into the rehab setting.
Rehabilitation, I love it.
Right. So the idea is that different games can be, there's Wii Sports where you might be able to play tennis or golf or bowling. There's also Wii... what's the other one? Wii Fit, where you can practice yoga or balance activities. So the idea is that you can use this with patients in the rehab world to work on their balance, their strength, endurance, coordination, all in sort of a more entertaining, fun way to get maybe people who need a break from traditional therapy, need to get motivated, more compliant with their rehab. You can introduce rehabilitation. And the idea, too, could be patients could compete against each other. There's an entertainment value there as well, while all the while still achieving your goals with your patient.
Having worked in therapy myself, compliance is huge.
Right.
I do, at the risk of thoroughly embarrassing myself, that how do you prevent people from... I've injured myself playing Wii. How do you prevent people from doing that?
Yes, it's a fair question, and of course, if our goal is to rehab people, we certainly don't want them getting injured in the meantime. There's lots of different ways that you can adapt Wii to make it appropriate for different patients' needs, and that's where the skills of a therapist come in, to be able to say, well, maybe you can't do this standing up, maybe we need to sit down and have you do this, or kind of go over different strategies and ways to keep people safe while using the Wii.
Just don't let them do the pitching maneuver. That's a tough. I think I need a little therapy there.